Hello, and thank you for watching my presentation. My name is Gabriella Cimino, and I'm a student in the Doctorate of Athletic Training program at A.T. Still University. With the help of Dr. Lam, I completed my project titled Epidemiology of Wrestling-Related Injuries Treated in U.S. Emergency Departments from 2007 to 2020. I would like to take this opportunity to thank Dr. Lam for his help and guidance throughout the course of this project. Without him, this project would not have been successful. We have no conflicts of interest to report for this study. Wrestling is a sport that has been around for thousands of years and is known as one of the earliest sports in the modern Olympics. It is a sport with a high injury rate at 2.26 injuries per 1,000 athlete exposures, which is behind only football and ice hockey at the high school level. There are three types of wrestling: folk style, Greco-Roman, and freestyle. Folk style is the type of wrestling that most North American wrestlers participate in at the youth, high school, and collegiate levels. The onset of most wrestling-related injuries is often acute or sudden and often occur during takedowns due to their high speed and intensity. The most common injuries in wrestling include sprains, strains, and fractures, which are all acute in nature. Wrestling injuries increased from 2000 to 2006. That finding was reported by Myers et al., who conducted a study evaluating wrestling-related injuries treated in U.S. emergency departments from 2000 to 2006. Another study did examine wrestling-related injuries presenting to emergency departments through 2018. However, they compared in-season and out-of-season injuries, did not capture full year's worth of data. There have been no updated studies that evaluate entire years' worth of data on wrestling-related injuries reporting to the U.S. emergency departments since 2006. The purpose of this study was to update Myers et al. And provide injury rates and patterns for wrestling-related injuries presenting to U.S. emergency departments from 2007 to 2020. For this study, we utilized the National Electronic Injury Surveillance System, or NEIS. The NEIS is a database of publicly available, de-identified data on conditions treated in emergency departments across the United States and provides data on roughly 350,000 injuries reporting to the emergency departments annually. The NEIS is a probability sample of approximately 100 hospitals and is conducted by the U.S. Consumer Product Safety Commission. We built a query from January 1, 2007 through December 31, 2020 in the NEIS database. The product code we utilized was 1270, or wrestling. In order to update the study by Myers et al., we followed their exclusion criteria, so we excluded females from our query. Once the query was completed, the data were downloaded and each line of the data set was examined for possible exclusions. Data were excluded if the injury did not occur at a school or place of recreation or sports, or if the narrative portion described a non-organized wrestling event. All of the data points that met our inclusion criteria were further analyzed. For this project, we utilized frequencies and percentages to describe wrestling-related injuries. We also calculated incidence rates for the years 2007 through 2019 using U.S. Census data to abstract population estimates. Incident rate was calculated as the number of cases per 100,000 people per year. Our query resulted in 11,865 patient cases, of which 1,021 were excluded based on our exclusion criteria. So 10,844 patient cases were included for our study. A population-weighted estimate of 374,020 wrestling-related injuries were estimated for the study period. The majority of injuries occurred in the scholastic age group, which is 12 to 17 years old, at 87% of injuries reporting to emergency departments occurring in that age group. The three most common injury diagnoses were sprain, strain, fracture, or other not stated, accounting for over 63% of total injuries reported to the emergency room during this study period. The most common body parts injured in all athletes were the head, shoulder, knee, elbow, and neck, which account for over 50% of total injuries reported. Interestingly, the most common injured body part for the youth age group was actually the elbow, followed by the head and shoulder. Over 99% of injuries occurred at a place of recreation or sport or at a school, which is consistent with our inclusion and exclusion criteria, although there was a small number of injuries that occurred at a location that was not reported. Over 96% of patients were treated and released or examined and released without treatment. This slide shows the mean incidence rate for each year between 2007 and 2019. Complete census data was not available for 2020 at the time of this study, so mean incidence rate was not able to be calculated for that year. The mean incidence rate increased overall from 2007 to 2011 and then decreased from 2011 to 2019. The highest mean incident rate occurred in 2011 with an incident rate of 3.2 per 100,000 people. The lowest mean incident rate occurred in 2008 with an incident rate of 2.3 per 100,000 people per year. During the study period, an estimated 374,020 wrestling-related injuries were treated in U.S. emergency departments. Myers estimated a weighted total of 173,604 injuries during their study period. It is important to note that Myers did not report mean incidence rate for each year, so it is difficult to compare injury rates between our studies. Age distribution of wrestlers presenting to the emergency department was similar in both studies. Myers reported 92% of injuries occurring in the scholastic age group, and our study shows 87% of injuries occurring in that same age group. The most common body parts injured during the study period were the head, shoulder, and knee. This is consistent with previous research by Hammer, Yard, and Pask. The scholastic age group in our study aligns with these previous findings. However, in the youth age group, the elbow was the most common injured body part. Comparing wrestling-related injuries treated in the emergency department versus those treated on site, sprains, strains, and concussions are the most common diagnosis treated on site. The current study, as well as previous research by Peruccio, Pappas, and Myers, report sprain, strain, and fractures as the most common diagnoses treated in the emergency department. Athletic trainers have the ability to reduce the number of common non-emergent injuries that are currently being treated in the emergency department, such as sprains, strains, and many concussions. Yard et al. Reported an incidence rate of 2.33 per 1,000 exposures in high school wrestling athletes in the 2005-2006 school year. Comparing to our study, the highest incident rate was 3.2 per 100,000 people in the year 2011. Yard utilized the high school sports-related injury surveillance study for their incidence rate calculations, whereas we utilized NICE data. The difference between the databases and incidence rate reported illustrate the high number of athletes being treated on site for wrestling-related injuries compared to those being treated in U.S. emergency departments. This further illustrates athletic trainers' ability to reduce emergency department visits for certain injuries. Because our study used de-identified data with no access to participants, it was impossible to determine individuals' reasoning for seeking treatment in the emergency department. Therefore, we were not able to determine why emergency department visits increased from 2007 to 2011 and then decreased from 2011 to 2019. There was also no information provided on other treatments provided before or after the emergency department visit, such as other physician visits or treatment on site by athletic trainers. Finally, because we were updating a previous study using their exclusion criteria, we could not use female injury data or include more locations where injuries could occur. This potentially impairs how representative the sample is compared to the population. Our findings suggest that wrestling-related injuries reporting to the emergency department increased from 2007 to 2019, but with notable decrease between 2011 and 2019. The majority of injuries occurred in scholastic age wrestlers, aged 12 to 17, and nearly one-third presented with a sprained strain. The large majority of patients were treated and released from the hospital. Further investigation should evaluate secondary school athletic trainer access between the years of 2007 and 2020 and evaluate if that access and injuries treated by ATs potentially reduced emergency department visits for wrestling-related injuries. Thank you for your time and attention to my presentation. If you have any questions or would like to discuss our study or my Cubify poster further, I would be happy to speak with you, and I have included my contact information on the current slide. Thank you.